Welcome to the Global Addiction Therapeutics Innovation Day.
Our next speaker is Dr. Min Zhao. Dr. Min Zhao is a professor of psychiatry and president of Shanghai Medical Center, Jiao Tong University in China. And the Shanghai Mental Health Center is the biggest facility in psychiatry and is a national center of mental disorders. The topic of Dr. Zhao's talk is digital intervention in addiction treatment, enhancing access and outcome. Now, welcome, Dr. Min Zhao.
Thanks for Dr. Hao. Actually, he is my mentor. It's very glad to be here, and also thank for the organizer for inviting me and to present some of our work. It's such a good pleasure to see a lot of colleagues when we see remotely or online. Well, very glad. Okay. Thank you. I'm talking about a little bit of work about digital medicine. Actually, we're doing in China in last 4 years. So this is our team. Our team is more like psychiatrist, more clinician based. So we do a lot. We do research, translational research. We also do some just mentioned. We do also more neuromodulations. But right now we present some work on digital medicine. In China, methamphetamine is the #1 of drugs. So many of our works very focused on methamphetamine. Also, some work on gaming disorder is also increasing problem among the adolescents. So we do some work on gaming disorders. We all agree that addiction is a global health challenge, so I'm not going to explain that. But in the treatment, in the clinicians' practice, we made a lot of challenges. We like the intervention, the precise intervention for different pathological markers. Like some comprehensive treatment who integrate all kinds of interventions. Psychotherapy as a main, I think, is a very effective and a very important way, but we have not, we don't have enough personnel which limited its access to the treatment. That's why we think digital medicine has the potential to improve the accessibility and the outcome of the treatment. That's why we're doing that. We have a lot of literature showing that the digital medicine can be useful from the assessment, diagnosis, treatment, and rehabilitation. Also, some more technology like wearable device, EMI and CMT, so make it possible for us, for the clinicians to capture their behaviors or their psychological status, so which makes it more objective evaluations for their behaviors. Also, intervention, I think, is digital medicine have a lot of implementation in the intervention. Or we see from the literature, the intervention can be used as like psychoeducation, also can be like therapist. Or we see a lot of therapists is based on the CBT or ACT or some other kinds of psychologists. Yeah, but there are a lot of increasing work in these areas. But from the literature, we see that there's a few, all the products, or maybe it's made or is produced by some companies, but I think they're not, or clinical trials is needed to prove their efficacy. So I think working collaboratively with a company or with with professionals is very needed to work together to produce more reliable or effective digital medicine. So there already have some works in this field. We can see from this systematic review, we can see the digital psychotherapy or psychological intervention can be used for all kinds of substance use disorders, including depression. So that's why we use that. We emerge in that. We integrated the digital medicine in our clinical world. So because the methamphetamine is the #1 drugs in China, so we developed a model. We call that whole course accurately, repeatedly, and measurement-based treatment model. We call that one model to help the patients with methamphetamine use disorders. So in this model, we use new technologies like to access the screen, diagnosis, and treatment through the whole course of this disease, from prevention, treatment, and rehabilitation in the community. So there are several digital medicine we do in China here for prevention, and we develop a gaming a screen for gaming disorder, a screen 2, and also we develop a screen 2 for the methamphetamine. Also, we develop a rehabilitation system after the patients in the community. Right now, we are doing some generative AI chatbot for mental health. So I'm going to elaborate that one by one. So first one, we develop a software or IPP. We develop for the game disorders. We integrated the questionnaire and some behavioral tests. So we use a game Q sensitivity test. So to screen people who use games based on the ICD-11 criteria. And the second one is because in China the adolescents they use game a lot, so we develop a prevention program. We call that Game Beats Game. So this is for the adolescent in school. They use the interactive game. These games character. They play with a game character and use some variable device. So to practice some life skills like emotional regulation, like stress management, such as something like that, or based on the CBT philosophy. And for the methamphetamine, we develop a VR-based assessment system. So we combine virtual reality headsets, and EEG, and some we use the VR Q-induced scenarios. So in this way, we hope to access the craving more subjectively So this is the result. We can see the craving is positively related with the high frequency power of HRV. Also, the heart rates, the heart rates is also positively related with the craving. And we think it might be more accurately access the craving. So we use that for the diagnosis in the clinical. Another thing we do for the methamphetamine addiction patients is we design a computerized cognitive addiction therapy. We call that CCAT. We all know methamphetamine has damaged their function, their cognitive function. So we develop 5 areas of trainings. One is how to remedy their attention bias and attention control and working memory and the 5 areas we have 10 sessions. So this is designed for our clinical trials. The intervention lasts for 1 month. Each day the session, each week we have 5 sessions. So after and before the intervention, we have some EEG, we have some test for their cognitive function. We use CogStage. It's a computerized cognitive test. So this is the result. So we can see after 1 month of CCAT, the patients have increased their working memory and vocabulary memory, and their attention bias is decreased. Also, their impulsive impulsive decision parameter is also decreased. So this is the new work we are doing now, because the psychotherapist, we need the interface with a real human, so the empathy is very important. So we develop a virtual avatar-based therapist. This is the girl who is the figure we developed. So we this system have assessment and intervention. The intervention is based on CBT and motivational interview and other techniques. So we call this system ECHO. It can be used in the phone or in the pad, or you can use it in the like small rooms, which in the rehabilitation centers we can use that separately. So this is the data we have. For limited data, we can see after 1 month of the therapy, of the intervention, the motivation and is increased, and the craving also decreased after 1 month of intervention, and we can see other improvement in like their mental health and status, like anxiety and depression and their sleep quality also increased. This is for methamphetamine addiction patients. And we modify that for the alcohol use patients. So this one is the result is the same philosophy, but this for alcohol use disorders. So for the alcohol use disorders, we also treatment interventions for 1 month, and after the intervention ended, we follow up them for another 2 months. So we can see the the craving is decreased, and also the relapse the relapse rates we can see is decreased, but for the sector follow-up, no difference. Also, we can see some other like sleep quality and some anxiety is also or stress level or also is effective decreased by this intervention. So the another work we see after the return to the community. So we develop a community-based rehabilitation management system. We call it care. We care the patients. So this IPP we can use that for the social work. They follow up the patients each week. And the doctors also can use the IPP, so interactive with the social works. And if they need help, we can get some interventions, emergency response, and in the background, we can follow up the patient's activities, like which area they are going and what's mood they can this is background. So this another one. I'm not going to go details for the high risk alcohol use disorders for the third time. For the time, because time I'm not going to go details. This another one is for the for the prescription medication overuse or misuse. For this for training the doctors. So how to remind them the prescribe is rational or not, is not good or something. Okay, this is a work I read from the next speaker, or from the Dr. Johnson. So that's we from this one we get we doing the similar work, the generative AI chatbot for mental health treatment. So we use over clinical data. And the test or the record, or the medicine record, we use a large language model base and develop one algorithm for negative emotions. But this work is still going on. The Chinese large language model is called Yuanjing 9B. It's a telephone company. So this is the aim of this negative emotion algorithm is to screen or for the negative mood or anxiety or depression for in the middle school. This only several work we are doing now, but we think we need some guidelines or some consensus on digital therapy for addiction disorders. So under the leadership of Professor Hao, we develop an expert consensus. This I'm sorry, it's Chinese. I think it's like more than 20 experts in China. We develop an expert consensus. The definition, how it's used as aesthetic security or quality control. So I think it's also very important when we use that in the real world. There's a lot of work is going on, but I think still some issues and challenges exist. For example, how to standardize the therapy. and the security of the data, or how to, when we assessment, how to refer long-term effects, we need more like clinical studies. And the accuracy of the algorithm is need more like proof, more study. And I think with the technology and improvement, we will serve our patients better. So patients first, I think. So we hope we can collaborate together to improve the mental health service. Thank you for your attention, and thank you for
Thank you for the wonderful presentations. And I think the digital therapy, especially combined with modern generative AI, it's become the new trend in the medical treatment, especially in the mental health area, in the treatment addiction. So thank you, Dr. Zhao. Any questions? Okay. Please introduce yourself before the question.
Okay. I'm Yichun Chen from Veteran Hospital in Taiwan. I'm very impressed of your various mobile phone applications of your research team. Considering addicts are prone to immediately reward by external incentives rather than internal incentives. My question is about what are good design do you think of application programming to enhance the internal incentives, such as reward by confidence or being better self by making self less problematic?
Thank you for your very important questions. I guess your question is for the content of the intervention itself, or for the products itself. For the product itself, I think how to make it more like attractive. I think under the intervention, it should be evidence-based one. Should be we already proved that it's effective. So we move that in the digital medicine. I think it's very important. But for the internal, I think for the product itself, I think the friendly use and attractive and I think it's very important, because I don't think the products can be used by the patients themselves. They use with the help with the professionals, so we should collaborate together. So incentive is not the priority for the products. For my personal review, so we think it's more the content is more important for the scientific based evidence is more important. I think. I don't know if I answer your questions. Thank you.
Okay, thank you, Dr. Zhao.
Organized by International Society of Addiction Medicine, sponsors and co-organizers, CNRE, Indivir, Spark Biomedical, Salofa, Ethifarm, University of Minnesota, European Union Drugs Agency, UK Office for Life Sciences,